Why does brain tumor chemotherapy stop working? Chemotherapy is a common treatment for brain tumors, especially glioblastoma. However, many patients find that their treatment stops being effective over time. This can happen for several reasons, which are quite complex. One major factor is how tumor cells adapt and develop resistance to the drugs. One key player in this resistance is an enzyme called 6-methylguanine methyltransferase, often shortened to Mismatch. This enzyme helps repair the DNA damage caused by certain chemotherapy drugs, like temozolomide. When tumor cells have high levels of Mismatch, they can fix the damage and survive the treatment. In fact, the level of Mismatch in a tumor can predict how well a patient will respond to chemotherapy. Tumors with low Mismatch levels tend to respond better, while those with high levels are often more resistant. Another reason for resistance is a problem with the mismatch repair system. This system usually helps fix DNA errors that occur during cell division. If this system is not working properly, tumor cells can tolerate the damage from chemotherapy and continue to grow. Moreover, brain tumors like glioblastoma are very diverse. They consist of different types of cells, some of which can quickly adapt to the treatment. This diversity means that while some cells may die from chemotherapy, others can survive and lead to a recurrence of the tumor. Changes in signaling pathways within the cells can also contribute to resistance. For example, alterations in pathways involving proteins like epidermal growth factor receptor, tumor protein p53, and phosphatidylinositide 3 kinase can help tumor cells survive even when chemotherapy is applied. Physical barriers in the brain, such as the blood-brain barrier and the blood-brain tumor barrier, also play a significant role. These barriers limit how much of the chemotherapy drug can reach the tumor, reducing its effectiveness. Additionally, there are specialized cells within tumors known as cancer stem-like cells. These cells have unique properties that make them resistant to chemotherapy. They can repair DNA damage more effectively and often have mechanisms to pump out drugs before they can work. After treatment, these cells can repopulate the tumor, leading to a relapse. Lastly, chemotherapy can sometimes select for resistant cells. While it kills many of the sensitive cells, the resistant ones may survive and multiply, leading to a situation where the tumor no longer responds to the same treatment. In summary, brain tumor chemotherapy may stop working due to a combination of tumor cell adaptations, genetic changes, and physical barriers that limit drug delivery. Understanding these mechanisms is crucial for developing new treatment strategies. Always consult healthcare professionals for personalized advice on managing brain tumor treatment and resistance.